Good afternoon, ladies and gentlemen. I'm a dentist, and perhaps if you have a look at these teeth, they don't look so nice. So the problem we have today is not the caries problem. I think we already overcame the caries problem. But you as managers, perhaps, you're also getting rid of your stress working with your teeth. And if you're clenching, if you're grinding with your teeth, they look like that. And you see that you have lost some tooth structure, and we have to find a strategy to replace that tooth structure. And as you see it here, it can be even worse. So we can grind our teeth down almost to the gingival line. And we have different strategies to replace the tooth structure. The first strategy we have is we grind the teeth, we do the preparation, as you see it on the right-hand side. So you already lost some tooth structure, and it's a little bit paradox that you grind away additional tooth structure, and then you replace everything with a ceramic restoration. You can do that, but if you do that, you're very much dependent on the compliance of your patient. You have a high risk because you're working with a ceramic material, and the modification, when you want to do some modifications, then it's very difficult. So when we want to do the replacement of the tooth structure, when we want to do it directly, perhaps a different material might be the material of choice. So we can do that, and this technique has been described before. I think you're all familiar with that. If you need a filling at the dentist's office, you all remember that. Then we have the direct approach. We have the filling. It's light cured by ultraviolet light, and then you can chew on this composite material. We can also do that when more tooth structure is lost. So we can build up a whole dentition with this direct technique. But you have 28 teeth, and perhaps when you got a filling at the dentist, you remember how long it takes just to get one filling. So if you need to build up 28 teeth, you will have to spend a whole day at the dentist's office. So it's a nice idea to do it like that, but it's quite demanding technically. But the material itself, it's a composite material, it might be a suitable material. If you don't want to spend a whole day at the dentist's office, the dental lab technician can fabricate the restoration. So this was an idea described from my former group in Munich, together with Daniel Edelhoff, and we did the replacement of the missing tooth structure in an indirect technique with a CAD-CAM technology, with a milling technology, but just from a PMMA material. So the PMMA material, of course, does not have the same wear resistance as a composite material with the ceramic fillers. So the fabrication is quite innovative, but the material itself is just a provisional material. So when we want to get one step further, when we want to do the composite material, of course, we can also use composite in an indirect technique. And this is what one of our former associates, Jeremias Hai, did in this study. So we had the composite material, milled that, and replaced the missing tooth structure with the milled composite material. You see it here. Yes, you get quite decent looking restorations. You have a good material, a suitable material for that, but the milling of composite, as it contains a lot of ceramic fillers, is quite difficult. So the additive manufacturing for those composite materials might be the better solution. And we just did a clinical study on that and did the additive manufacturing, used the additive manufacturing for the printing of the composite. As you see it here in this case, a worn down dentition, and then with some technical devices, with some digital devices, we were able to design the restoration in the dental laboratory, and then they are printed, they are polished, and they can be adhesively bonded to the patient's existing teeth. So as you see it here, we can give the vertical dimension back to the patient, we can give the aesthetics back to the patient, and we have that from composite material, from printed composite material. So this might be a solution that is smarter than the other indirect techniques. And also the potential, when we are talking about composites, we have the resin, we have the ceramics, and all of us in this room might have a different need of a material as or we don't have the opportunity that one material fits every indication. And so with the 3D printing technology, we can now adapt the material to the need of every individual of us. So we can raise the amount of ceramics when we need more wear resistance, or we can lower the amount of the ceramics when we need more flexibility, which is dependent on the patient. So we can now personalize the material, the restorative material. Or some of us might need more translucency or less translucency, and we can adapt that by adapting the ceramic and the resin filler content. But we can also print ceramic restorations. And when it comes to restorative dentistry, most of the permanent restorations we do nowadays are ceramic restorations. As you see it here, we can print zirconia. Zirconia is the most popular material, or the most tooth-colored popular material we have in restorative dentistry. And as you see it here, yes, we can do restorations from that. And when we compare the printed ceramic material to the milled ceramic material, we see that we get at least the same flexural strength with both techniques. And we can also get the same accuracy with both techniques. So the additive manufacturing of the zirconia is on the same level when it comes to the mechanical performance and when it comes to the accuracy to the milled material. But what additional value do we get when we now print the material? We can also mill quite easily. If we mill it, then we have a material that is supplied by the manufacturer, and it's not personalized. But now when we want to personalize the material, we can use the printing technology to add some value to the material that is important for the patient. Perhaps you're all familiar with that. We do a lot of implants in restorative dentistry. Around 1.3 million implants per year are placed in Germany, and the biggest enemy of dental implantology is the inflammation of the soft and the hard tissue around the implant. So there's always bacteria involved, and if we would have a material that fights against those bacteria, then we would be a real step ahead. And this is what the printing of zirconia is good for. So we are right now working on a mixture of zirconia and different active substances to fight the personalized bacteria in the patient's mouth. So we see that we can influence the surrounding soft tissue and also influence the bacteria in the patient's mouth, arousing the restoration by the material. So now we can really customize, personalize the material to the needs of the patient with a 3D printing technology. So when it now comes to the approaches, the two approaches we see, on the one hand side, we can personalize the material in terms of aesthetics, in terms of mechanics, when we're just doing restorative dentistry. And when it comes to the printing of the ceramic material, we can also add some biological value to the material we would not be able if we just use the milling technology. So the next step from my perspective will be to customize the materials to the needs of our patients. Perhaps when we compare this with medicine, when I went to medical school, when a cancer therapy was really standardized, almost each cancer patient received the same therapy. Today we have a personalized therapy. And the same will be in dentistry. The next step in dentistry will also be personalized materials and bioactive materials. Thank you so much for listening.
So thank you so much, Florian. First of all, for keeping the time. That was awesome, by the way, with this amount of slides, and very well understandable. Thank you for that. And Neha, stage is yours.
Thank you for the nice introduction. So I would like to ask everyone who are from the medtech industry or the medicine background. So just to screen. Okay. So for the rest of you, luckily I don't have any surgery scaring blood kind of a picture. So yeah, we are good to go. So yeah, when I say point of care manufacturing, it's actually the manufacturing that is done inside the hospitals. So the idea behind this talk is more like how we do it and what's inside the hospitals. So you will see a glimpse into that. And yeah, as a disclaimer, I need to mention it, of course. So I come from the city of Basel, close by to, not exactly close by to Germany, but Berlin. And it's a beautiful city in the northwestern Europe region of Switzerland, situated in the river of Rhine. And one of the hospitals that we have is the University Hospital of Basel. It's the largest hospital in the northwestern region, and we cater to all the specialties dealing with medicine, surgery, gynecology, you name it, we have it here. And inside it, we have our 3D print lab, which is founded by my boss, Florian, together with our radiology department. So it's a joint effort that we have initiated here, and we have been building it up since a couple of 5 to 6 years now. And we also have a research group associated with the University of Basel, which caters to medical additive manufacturing projects. And we also have a core facility, which is more like a service provider within the University of Basel to our external partners and also other groups. So before diving into the 3D printing, medical 3D printing industry, I would like to start from the history, like what was the main 3D printing milestones we had and how it changed the impact into the medical sector. As you know, the first 3D printing is not new. It has been established or started since 30 years, but still into the medical industry, or even now, we are still struggling with using it. So the first printers were FDM printers in 1992, and then we have SLM printers. And on the medical side, what we saw was, in the beginning, we only had 3D milled models. So it was not printing rather than milling. But around near to the 2000s, what happened in the industry region was the development of the softwares, which were catered to the medical industry. And then we could have a possibility of kind of milled implants, the titanium implants, into the industry, which we could use for our patients. And we also had the possibility of anatomical models, which could be printed in SLA. By that time, procuring this kind of a model, this SLA model, was around 10,000 euros or something like that. That was the price that time. But something changed in the latest. So we had the first patent expiration of the FDM printers, and soon it followed with a couple of other patents. And what we see now is like we have a huge lot of potential for metal printers and polymer printers, and which has led to the second generation of printing. And now we see there's a boom of printing materials and printing applications in the medical sector. And even if we look into the future of surgery, this is the commission, which is by Royal College of Surgeons. And they clearly, in the 22 commission, they mention like 3D printing will be more and more, it will be more precise, and it will open the platform or avenues for other applications which are more complex or the outcomes that are poor. Coming towards the global trend, so we did a 30-year analysis since when the 3D printing was started in the CMF region, and we can see we have now an exponential rise in the number of publications, and still we see the major stakeholders are USA and China, could be also due to the population, but Europe is slowly guiding traction here. In CMF region, why do we need 3D printing? It depends upon the complexity. So starting from just the planning, we can have a predictable planning into our operating theater. It also supports us into our intraoperative guidance, and slowly we can move to personalized tools and personalized medicines. And at point of care, it's more like an interdisciplinary approach. It's collaborative, interdisciplinary. You get a lot of entrepreneurial spirit over there. So innovation is at the forefront when it's at the point of care. And being a 3D printing located inside the hospital, so we not just cater to ourselves. So we have a spectrum of our collaborations with different hospitals in the regional and also the national associations. So we work together with not just spin-offs, but also different companies, institutes, research institutes, hospitals. So it's a interesting, diverse environment over there. And a glimpse how it looks like. So we cater to the development of the products, basically also the planning. So we also have like teaching. Students are enrolled into the programs, which they can get actual hands-on experience on the day-to-day working of the cases. So, and Now we have like a couple of printers, depending upon the application, from FDM, from SLA, DLP, PolyJet. Metal printing is currently missing because we are still waiting for a desktop metal that can fit into the hospital space. But yes. And the benefits of 3D printing, it's not just printing an object. It can be used for prototyping. It can also be used for patient consent, for our simulations, surgical applications, even explaining it to fellow colleagues, to students, among the surgeons. Can be used for drill guides, jigs, quality control, and also implants. So just the face region, the applications are diverse. We can have 3D printed assisted models for trauma, for tumor surgeries, for aesthetic surgeries. So the applications here are pretty much diverse. And the latest addition is it's more like driving towards printing of implants. When I say this, innovation needs new perspective. So the technology is there, everything is there. You just need to rethink your ideas and see it from a different side. And what we have done over the years, it's like developing a validated workflow inside the hospital for point-of-care manufacturing of PEEK implants. So it all starts integrating this technology into our clinical workflows. So starting from the CT scan, doing the planning in-house, printing the part, post-processing it, up to quality control, and then the sterilization. So all these things, it's like a seamless integration of this technology into the daily workflow we have. Another projects that we are also working on, it's not just on PEEK, but also on other interesting materials, which could be reinforced carbon, reinforced PEEK, or even PEC, and also on the development of bioresorbable materials. So if I take the conclusion, or what take-home message I can give you all is, 3D printing, it definitely aids our treatment plans. It's a multidisciplinary approach, so collaborating with different departments is very beneficial. We have a group of surgeons, biomedical engineers, radiologists, even medtech experts, regulatory experts. So it's a huge chunk of different expertise that we bring in together. Cost and time savings are definitely there because of the reduced length of stay, and due to less complications, the operating time or the stay in the hospital of the patient is decreased, so the treatment cost can also decrease. And evidence reporting, definitely we need to support and promote this printing technology into the medical sector through publications, clinical trials, and also reporting the outcome of the patients eventually. MDR compliance is still a challenge, and we need to find a way how we can comply with these regulations and make it more not just a sole entity, but like a global entity. With that, thank you for your time.
Excellent. Awesome presentation, both of you. Really exciting, to be honest. It's one of my favorite topics, I must admit, because this is something we all get into use of in the future. Let me ask you a few questions that have been raised by the audience. Florian, first for you. Question from Christoph, by the way. Which post-processing of the printed teeth is required, for example, surface treatment?
So, yes, there is some handmade surface treatment required in the dental laboratory. So there is some polishing required, and also there is a varnish application on top of the surface. But it's also very important that the polish is surfaced.
One personal question, you showed the pictures, and when we have been talking about zirconia, you showed the color. Is the color then adapted to the patient teeth, or this would be a post-processing step as well, or probably in the production process, right?
Definitely, yes. So the restoration, the printed restoration looked quite ugly.
Yeah.
It was purish or opaquish white, and so usually I think you can use a nicer zirconia powder, more translucent powder, to get nicer aesthetics. But in most of the cases, we apply a veneering porcelain on top of that to customize the aesthetics and to make it decent for the patient. So right now we are not at this point that we can really print an aesthetic restoration completely from the computer or from the 3D printing process.
Very good, thank you. Neha, one question for you. A personal question. Do you really believe in printed personalized instruments for every operation, or will it only be for the hard cases?
Personally, I don't believe like you need printing for every application like implant, but it's more important to understand what printing is if you have a currently available solution already, if we are using hand-bended plates, but can we improve it further? So in those cases, complex cases, definitely we need a customized solution. But if it's like a minor fracture or something which we are already using and a simple plate can work, then we don't need printing for every operation.
Just one question regarding the process. Let's say you are in preparing of an operation and you are designing an instrument that should be used inside the operation. What about certification, quality, etc.? Because there's usually not the time to wait another year until you get the instrument being approved. How's that going on?
Yep, this is something like with MDR, it's soon coming into action, and soon we will see like we have different hubs in the world which are working on 3D printing, and soon we have to keep up with the pace, and even the hospital needs to be responsible to match with the compliance. So currently what we are doing is we are working on validating implants manufacturing, but in parallel we are also working on surgical guides and anatomical models. I must say in previous years when we started with this, we were not concerned about this. For us it was more like started with enthusiasm. But now we are more aware, and this is something that we would like the other hospitals also to be aware. Like so the regulations which are for the company should also apply to the hospitals, and we need to comply with them as well.
Thank you very much. A question from Gregor. Why do you not apply the ISO ASTM 52920 to demonstrate the MDR compliance?
In the morning when I attended this a session, and there was this interesting discussion going around, like our standards are still based on injection molding and other applications, and which are not currently driven by printing applications. So yes, it's like a play that we have to, like, we are expecting the standards which are injection molding, conventional standards, and then we are assessing the properties on a printed part. So we need development not just on ISO standards, but also these standards need to operate it as well.
You mentioned in your presentation the difference in speed, at least if it comes to publication, compared US, China, and Europe. Are there, let's put it that way, that's what we discussed this morning as well, are they faster because they are, let's take it, easier on certification and approvals, or where comes the speed from?
Speed comes from, I would say, like two things. One is the number of population, yeah, and also the regulations in China, and I mean European regulations are more strict, even I would say from US. So but sometimes being strict is also good. You raise up the bar and then you establish it. So even though we are a bit behind in the number of publications, but we should not be like second in quality.
Is there an exchange and cooperation between the countries going on?
I'm not sure about that.
Okay, yeah. No problem. It was just a personal question. So we have a more technical one, I think, Florian, that goes to you. Besides LITOS and DWS, are you using other AM system, machine and material, and how are the prosthetics designed?
So the prosthetics are designed with the traditional CAD programs. I think we have perhaps three big brands in the dental laboratory, which is a 3Shape, Exocut, and perhaps Zerona. And we are also using composite material and work together with the Beuer company. But when it comes to ceramics, perhaps LITOS is the most experienced company, which offers zirconia and also glass ceramic materials.
Okay, thank you. Then the individualization of teeth, probably. What material do you use here?
So when we are individualizing composite teeth, then we are using traditional laboratory composites. However, they are light curing, and they are very plaque, or they have a high plaque accumulation because of their light curing properties. And if it comes to printed ceramics, then it's quite easy. We just use the veneering porcelains for lithium disilicate or for zirconia. So that's perhaps the better solution for individualizing.
Very good. I need to ask a question because there's something that is interesting me most as well. We stressed this several times in other panels we had, so why not asking it here? What is the state of direct printing of organs? Yeah.
You mean in the application in the clinics?
Yeah.
Give it another 15 years?
Yeah. Very good answer. Straightforward. There's another question. Which SLA printers do you use in the hospital?
I mean, I don't want to promote any companies, but
That's
we
good.
have Formlabs printer
Yeah.
that has been our workforce since many years.
Okay. Florian, for you, do you use printing permanent single restorations? If no, why?
So, yes, when it comes to the materials, I think when we are printing a zirconia restoration or a glass ceramic restoration, I would always consider a ceramic restoration as a permanent restoration. Just from the company's point of view, also the composite material is considered as a permanent restoration. However, in our clinical study, we found out that the discoloration we see, because it's not, after the printing procedure, it's not a dense material. So we see a huge discoloration, which is disturbing the aesthetics after already 12 months, to be honest. And also the wear resistance of that material, of the composite material, is perhaps, we saw that we lost around 90 microns per year in the vertical dimension, and just as a comparison, if we compare that to natural enamel, we lose usually between 20 and 30 microns of natural enamel. So it's not as wear resistant, and it's also not as aesthetically stable as a ceramic material. But if we are talking about ceramic materials, then we can use that as permanent materials.
Very good. Neha, have you made cranial implants that can grow with a patient, for example, for pediatric cranial defects?
No, currently we are working on a non-resorbable material PEEK. For pediatric applications, it's more on the research side, bioresorbable implants, but we still have to evaluate like what could be the degradation rate and what could be the bone ingrowth.
Okay. And then really interesting in my point of view, because there's always a matter of money as well. So I would be interested in what is the estimated part of 3D printing in the daily dental clinic? Don't get me wrong, but this is a really, really interesting one. So is that something I will see in the near future?
We use it. I think the routine use for the 3D printing in the dental laboratory is really to print the models and the guides for implant placement. And I would say when we are talking about guided implant placement, then the 3D printed amount is around 100%. But if it comes to real final restorations, I would rather estimate that it's below 3 or 1%.
But will it come in the future? I mean, today we have the technicians that are doing it manually, or it's a profession.
So I definitely see it in the future. I don't expect it to be standard in the next 5 years, but I see the benefits, and I think the benefits will be appreciated by all the technicians, by the dentists and the patients. So I see it in the future.
Super. Thank you very much. We answered nearly all of the questions. What I really appreciated that was understandable, even for the non-experts. So thank you very much for your interesting presentations. Good luck for the future. Keep on going, because this is one of the most important parts in additive manufacturing. Thank you, two of us. Big applause for you.
Thank you.